Good morning on a brisk day here in Kalamazoo. I wanted to take a few minutes to share with you some of my thoughts and also some planning that we have for the next 2 or 3 weeks here at the medical school. First of all, I want to express my deep appreciation to all of you for all of the incredible work and innovation that's gone into making the medical school continue to function, to help meet the needs of our learners and especially our patients in these very unique times. I get to see some of the actions of the rapid response team members, and I get to hear some of the stories about all the work and the good deeds that are done by all of you throughout the medical school to help keep us intact and to help keep things moving along in a positive way. And we are making progress, even though we haven't been able to have the celebrations that we wanted to have for match day, and we've had to cancel graduation. Nevertheless, our students are advancing, our residents are going to graduate, our medical students are going to graduate, and we're going to continue to make progress and continue to provide the patient care that's needed here in Kalamazoo. Thank you for making that happen. We're going to continue as we are for at least till the end of April. We'll reevaluate this on a weekly basis, but I anticipate that we will continue as we have been doing. One change this week is that we have added the requirement that when you're in the medical school buildings, that you would wear a surgical face mask or a homemade cloth mask whenever you're in public areas. That means that when you're in the hallways, when you're in the elevators, anytime you're outside, maybe a personal office when you're all alone, that you need to wear a face mask. This is to protect you, but it's also to protect each other and to make the environment as safe as we can make that. So please make sure you add that to the list of things that you're doing besides washing your hands, not touching your face, and practicing good physical distancing. We're very pleased that we're able to collaborate with the county to participate in providing a collection site here. I'm on the site at East Alcott Street, where we are collaborating with the county to collect specimens that then can be tested at the state labs. It's been really pleasing to see how willing people are at the medical school. So this is a site that is staffed by volunteers, and I thank you for volunteering to be able to meet the needs of the community. This next couple weeks holds a lot of promise. There's going to be some really positive changes, I think, over the next couple of weeks in testing. One is I anticipate that we're going to have access to the rapid virus testing kits, which is going to make testing much more accessible to all of us and open up the opportunities to do testing beyond just symptomatic patients. Another option that's going to come in the next week or so is going to be the ability to do antibody testing. I think this is really going to help us understand the epidemiology, but especially help us understand how we can start to plan to return back to normal. Both of our research labs and our toxicology labs and the clinical labs, all three are collaborating to help develop antibody testing and to get the materials and the reagents that are necessary to do that. And we expect that that's going to be very informative to us in our own planning. I want to also let you know that we're continuing to working on getting all the personal protective equipment that's necessary. Last week we distributed the N95 masks to everybody who has patient contact. We're also distributing this week face shields and also scrubs to individuals so that we can make sure that you have the personal protective equipment that you have. We're very grateful to a donor who's made a contribution to the medical school to help us have those materials to supply, including Tyvek suits for everybody. So we don't anticipate that you're going to need the Tyvek suit, but you'll have one if the need arises. We've been able to share some of that personal protective equipment with both Bronson and Borges, and I know they are very appreciative of our anonymous donor who has helped us acquire those materials to the benefit of the community. I want to thank all of you for the sacrifices that you've made. I know that for some of our employees, it's a financial sacrifice as well. Our low census staff and some other staff at the medical school where the work is not able to be done at home. And we're very pleased that we're able to offer at least partial pay compensation for for low census employees. We are looking at the options that we have available through the stimulus package to see what we can do to make sure that we help everybody at the medical school as much as we can. I want to thank you again for what you've done. I do not think this is the end. I do not think this is the beginning of the end. But to paraphrase Winston Churchill, I do think that this is the end of the beginning. I think we're on a bumpy plateau right now for this next week, meaning that we're not going to have a peak and then a sudden decline, but we're going to have several days, and I think we're there where we're going to have several days where it's going to be about the same range before we start to see a decline. But we're going to need to continue to deal with this for the next 6 weeks or so. So thank you for all that you do. Thank you for continuing to take care of each other. And please take care of yourself and your families.